January 1944. The rain falls softly over a temporary American prisoner enclosure on a Pacific island newly taken from Japanese control. The air smells of wet earth, antiseptic, and boiled rice. Somewhere beyond the wire, a generator hums steadily, a low mechanical sound cutting through the jungle silence. For the first time in months, sometimes years, Japanese prisoners of war stand in ordered lines, not under shouted commands, but waiting quietly. Tin mess trays are passed forward. Steam rises. A bell rings, not as an alarm, but as a signal that food is ready. This moment mattered far beyond its simplicity. By the later years of the Pacific War, surrender itself had become rare for Japanese soldiers. Imperial doctrine emphasized death before capture, reinforced by training manuals, field indoctrination, and the lived example of earlier campaigns in China and Southeast Asia. To fall into enemy hands was portrayed as spiritual annihilation, worse than physical death. American forces, in contrast, were bound by the Geneva Convention of 1929, which Japan had signed but not ratified, and which the Imperial Army largely ignored. As U.S. forces pushed across the Pacific, Guadalcanal, Saipan, Tinian, Leyte, the number of Japanese POWs slowly increased, not by mass capitulation, but through battlefield injury, unconscious capture, or isolation. Each prisoner carried with him expectations shaped by years of propaganda and deprivation. Japanese soldiers expected brutality. They expected beatings, starvation, forced labor, and humiliation. Many believed American guards would exact revenge for atrocities committed earlier in the war. These beliefs were not abstract. Japanese rations had steadily declined as shipping lanes were strangled by American submarines. Medical supplies were scarce, morphine nearly non-existent, surgeries often performed without anesthesia. Disease, malaria, dysentery, beriberi, killed more men than combat in many units. Officers emphasized endurance through suffering as proof of loyalty to the emperor. Hunger itself became a moral test. What they experienced instead unsettled everything they had been taught. At American POW camps across the Pacific, and later in Hawaii and the continental United States, Japanese prisoners were issued regular meals, calculated to meet caloric standards similar to those of U.S. troops. Rice was supplemented with bread, meat, vegetables, coffee, and occasionally fruit. According to U.S. Army Medical Corps records, daily caloric intake for POWs averaged between 3,000 and 3,500 calories, often more than prisoners had received for months while in active service. Medical examinations were mandatory. Wounds were cleaned, bandaged, and treated with sulfa drugs or penicillin as it became available. Malnourished prisoners were placed on controlled diets to prevent shock. Dentists extracted rotted teeth. Lice were removed. Clothing was deloused. American medical officers documented their surprise at the condition of many captives. Reports from Saipan and Okinawa describe soldiers weighing under 100 pounds, suffering from advanced vitamin deficiencies, tropical ulcers, and untreated shrapnel wounds weeks old. Yet within weeks of captivity, weight increased, infection rates dropped, and mortality declined sharply. U.S. Army Surgeon General statistics show that death rates among Japanese POWs in American custody were significantly lower than among Allied POWs held by Japan earlier in the war. This contrast did not go unnoticed by either side. The recurring symbol of this transformation was the meal tray. Metal, plain, unadorned, it arrived 3 times a day with mechanical consistency. It carried rice that was clean and unspoiled, meat that was not rancid, vegetables that had not been scavenged. For many prisoners, this regularity itself was disorienting. Hunger had been a constant noise in their minds. Now, the sound of the bell signaled not scarcity, but predictability, not privilege, but routine. The tray became a quiet argument against everything they had been told. American intelligence units took careful note of psychological changes. Interrogation reports reveal that prisoners initially refused food expecting poison or mockery. Others ate cautiously, convinced the generosity would soon end. Over time, attitudes shifted. Some prisoners volunteered information not under coercion, but out of a sense of obligation or confusion. U.S. psychological warfare analysts later concluded that humane treatment undermined Japanese wartime ideology more effectively than force. It revealed a contradiction. The enemy did not behave as the enemy was supposed to. This experience reshaped perceptions in subtle but lasting ways. While captivity did not immediately erase loyalty to Japan, it fractured the moral certainty that had sustained many soldiers through hardship. The emperor-centered worldview depended on the belief that Japan alone embodied virtue, discipline, and spiritual superiority. Yet here was an opposing system that fed its enemies, healed them, and enforced rules even in war. American guards were not uniformly kind, but the system itself functioned predictably. Abuse was punished, medical care was standardized, food was accounted for. Democracy in this context was not debated, it was practiced administratively. After the war, many former Japanese POWs became unexpected witnesses to this contrast. In post-war interviews conducted by Japanese historians in the 1950s and 1960s, veterans recalled captivity not with gratitude alone, but with unease. Some described shame at realizing they had been better fed as prisoners than as imperial soldiers. Others noted that American medical care saved limbs or lives that would have been lost in the field. These recollections complicated post-war narratives of victimhood and honor. They did not erase suffering, but they introduced comparison. The bell rings again. Another meal. Another day marked not by survival through deprivation, but by the steady rhythm of care. The tray returns, empty, then full again. It is not luxurious, it is sufficient, and in war, sufficiency itself becomes revolutionary. In the end, this quiet encounter between enemy and system revealed something larger than tactics or treaties. It showed how ideology expresses itself not only in speeches or flags, but in logistics, medicine, and routine. Freedom in this sense was not abstract. It arrived measured in calories, bandages, and time. For Japanese POWs who had been taught that surrender meant the end of humanity, the simple fact of being fed and healed became an unintended lesson, one that echoed long after the war ended, like the steady hum of a generator in the rain, powering a different way of living even amid destruction.